Welcome to another episode of Vital Doc Talk. And on today's episode, we're interviewing Dr. Angela Cortal. Dr. Angela, welcome to the show.
Thank you so much for having me.
Awesome. And so on this episode, well, first of all, let's start off with the basics, your background, how you got here today and like plans for the future.
Sure. So I'm a naturopathic doctor. I'm based in
Mm-hmm.
Oregon, and
Mm-hmm.
I graduated about 8 years ago and have been in private practice. I practice in clinics in Portland and Salem. And through the course of my practice, I got really interested from a personal level in regenerative injection therapies
Mm-hmm.
for my own chronic knee issues, injuries, post-surgical issues. And so I studied in that for a few years and started bringing that into my practice that was predominantly women's health and hormone focused previously. And so now my practice is definitely like a foot in both worlds of the whole chronic joint pain and sports injury, kind of chronic lingering injuries, and addressing that perhaps with injection therapies, but then also being really cognizant of how our hormones have a big impact and influence on how our joints heal, how we recover, how that joint and connective tissue regenerates. So that's what I've been doing for the last few years, and also teaching other doctors how to get into this field, into the injection therapies. Speaking at some conferences, whether it's naturopathic conferences or I'm a part of some professional organizations for injection therapies, and really being a cheerleader sometimes in those realms for it's not, don't just jump right to the injections. You got to look at the whole health of the person, make sure that they're a right candidate kind of with all of the systemic factors that might be a part of that there. And so, yeah, I was pretty busy with my practice, with traveling for speaking, teaching, and then COVID meant that all of that was on hold, and a lot of that still is on hold. And even now, let's see, right around 5 months after we did a temporary kind of full in-person closure and remote only to my practice, then slowly I've been seeing just a very, very limited number of patients in person if they're needing something specific like the injection therapies, but mostly doing everything remote, and this time from working from home, which I'm at my home office right now.
Nice. I
And
am too. I don't know if you can tell these two doors over here. Yeah.
yeah, I had all these, all of these are real knickknacks from my home collection of, I just collect old medicine bottles and things like that. And so when I put together the home office, I thought, I got all these just sitting around my house, time to make, to curate a little display. And,
Smart. I like that.
so yeah, being at home and still doing most of my work from home. Most of my patient visits are still video based. I've now just been getting more into online education. I also did a lot of community talks and classes and things like that. And so with everything going online, a lot of that also has been going online. And so I've been doing a lot more one-time classes, or gosh, the whole world is via Zoom nowadays. So doing maybe a specific class on movement for joint pain. I'm doing a book club, also virtual via Zoom, for my new book that was published last month. Doing online challenges for just kind of the general public, again, on the topics of joint pain and kind of self-care for joint pain, and then getting more into further online courses.
Very, very cool. And so how did you grow your practice? Like, what's your favorite marketing method been to date? And, tell me the story. And, oh, by the way, also, before we get into the marketing section, what about for the future? What are you looking to capitalize on, or where do you see yourself in the next 5 years?
That's a good question. I think that that this sort of everyone was forced to do something, to do everything a lot more online based was in some ways a good push. I had always been thinking like, oh, that would be a nice project to get around to do. And, you know, when I have some time, I can do that. And so it was suddenly like, oh no, now starting today, kind of in your face, we're doing this. And so I think that's going to continue. I will be continuing to develop a lot of my education online and sort of bridging that gap between just a blog or a social media post and seeing patients, you know, in person. That had kind of been the two ends of how people knew me and knew what I did. And now I'm sort of filling in that whole spectrum of the online education and courses, and sort of having things that people can work through on their own, and then maybe see me in a clinical capacity or not. Yeah, I think that's definitely going to be continuing. As far as practice building and what I have enjoyed and found beneficial, I've always been a big networking person, not necessarily going to a business networking meeting, although I've certainly done a number of those, but just in terms of kind of going and doing my own research on who would be a great connection. And you know, I probably, for the most part, didn't meet them at a certain business meeting, but really just found their email or wrote them a letter or something like that, or found them on social media is more common nowadays, where I've identified certain professionals in my community where I thought, I want to learn more about you. I want to learn about your practice, and sort of how can we have a mutually beneficial relationship. So I've always been
So
very,
that
very
actually
targeted
worked for
towards
you.
that.
That's
Yes,
beautiful.
yes.
So we have not talked about cold outreach
Yep.
a lot on the show. So let's dive right in. And so what's your go-to method? Is it cold email? So let's say you find Dr. Joe. Dr. Joe runs I don't know, whatever, an injection clinic that specializes in everything opposite of what you do. So it's like perfect, right? Because I think everybody can think of like an ideal partner. So I'm trying to think. So, okay, cool. So you find them probably through Twitter, or where do you start your research?
Just Google online website, and I would say provider types. I'm most commonly doing this. As a naturopathic doctor, I do know a lot of naturopathic doctors, and that's quite a common profession in Portland. So that may be something where I'm finding a provider who just has a different focus. But for the most part, I would say it's a little bit more chiropractors, physical therapists, and acupuncturists, where they are treating patients with pain. I have a very specialized angle on chronic joint pain, and so yeah, I think I'm someone who always cold contacts people. Like I think there's probably a lot of hesitation around that. Others might think like, well, I don't know, or I don't want to bug them, or I don't think it's going to work. And like, what do you got to lose? You know, just put yourself out there. And I would say the biggest things that come to mind on this topic is that I'm picking people specifically. I'm not blasting a postcard or a folder of information to every clinic in Portland. That wouldn't be a good use of my time or resources. I'm doing this really targeted. Do I know a colleague? I've had a lot of introductions to people where maybe I knew a chiropractor who focuses on pregnancy and prenatal care. Maybe I know them personally, for example, but they know a sports medicine chiropractor who would be a lot more aligned in terms of our patients and what we're providing to them.
And so basically so do you have like a weekly schedule of how you do this, or how did it go? Like every Monday you spend 30 minutes searching for doctors, and you spend 50, and once you find somebody in the first 30 minutes, then you spend an additional 10 minutes per doctor. What's the system look like? Like if you're teaching a doctor how to do that? I know doctors in everywhere, in Washington and Florida, et cetera, that we've had on the show that do this.
I think that sounds like a really great amount of organization, and I'm a little bit more free flow with it. So probably what I would be doing is once a month or once a quarter, like this is my project for right now, say a half day or something, and just doing all the research, creating maybe a small spreadsheet, organizing out the contact info and how do I know them, or do we know any people in common, and how does it seem like what's the best way to contact them, where are they most visible. And I have even on occasion just called up an office, and for a lot of places they're really open to having another provider stop by and say, you know, can I, either over the phone or just literally, I've showed up at other people's clinics and said, could I have some time? I'd like to talk with this doctor. I'd like to find out more about their practice. And for the most part, that goes pretty well. I don't know, I guess maybe that's surprising to people, but yeah, it's not, that's the part I want to underline is it's not a blast thing. It's not everybody. It's targeted, it's focused, it's based on what you do and how you can help them provide better care to their patients. Because that's another thing, I think a potential stumbling block that can come up is you have to be clear in your position and your communication, your message, that I'm helping you help your patients. Because some doctors, there will be some that are just not open to this. They don't want to meet with you. They don't want to talk with you. They won't write you back because they think that you're going to take their patients. They see this as a competitive thing. And I get where some people can come from that. So you just have to be really clear that I don't want, I would love to be considered as a referral if you think it's the right fit for some of your patients, but I'm not trying to take your patients. I'm not wanting to transfer care and just see them.
Do you explicitly tell them that?
How I would
Or you
say,
feel it out?
how I would say the messaging goes is, say like this has happened with a number of chiropractors, and I still have great relationships. Years later, they send me patients, I send them patients. And I may say something along the lines of like, I'm not wanting to see your patient indefinitely. I'm wanting you to view me as a resource, as another opinion, to check in. I don't focus on the same things as you. I'm looking at really what are the sources of their joint pains. I'm looking at ligament, tendon
Got it.
issues.
So you really clearly differentiate, hey, okay,
Yep.
so this is what you do. By the way, this is what I do that's really unique that nobody else does. And then,
Yep.
you know, look at me as a resource for like an enhanced treatment. If something's not working, then I would love for you to contact me. So then maybe I could see if there's any additional things we can take care of.
Yep. I explain, a lot of providers are really interested in regenerative injection therapies. I explain like my role would only be as seeing if your patient is a potential candidate, providing this service. It is time limited. I'm not seeing patients, you know, indefinitely. It's a short course of care. I'm wanting to send them back to you because I see, and I do see this very commonly, that if someone is a candidate and gets prolotherapy, for example, their adjustments can often hold better, and they're responding better to that original referring provider's care.
Got it. So I think the core essence is this is how it's going to enhance life for your clients, and I'm going to take care of them, or patients, I guess, is in the doctor world, is like, I'm going to take care of your patients this way, and that's how it's going to actually help you in the long run. And they're going to stay with you better, or your service is going to be looked at as better. And I think some agencies and companies and et cetera have the same mentality in the business world, right? And same thing in the medical world. Like, it's like either we can collaborate and work together, and it's just all about the client and helping them and the patient, or it's like, hey, you know, I just want to do everything. Like, I know some doctors like that too, who just pretend to know it all.
I gave up on that a long time ago.
Yeah. Do you train the chiropractors or other doctors you work with? Do they ever seek your training instead of just sending you patients? What does that model look like? Does it have a model?
I would say that some of them do seek care, and I'm actually really excited to be providing other healthcare providers in my area a treatment. I've had a lot of physical therapists and chiropractors, and they're active people, and they have their own, you know, chronic whatever shoulder or hip injury, and if they're a candidate and we do the injection therapies, that's wonderful, because now they have that personal experience and they can talk about that with patients. A lot of patients, understandably, are pretty hesitant or concerned or maybe even needle phobic, like they're like, oh, I don't know about this. And to have someone say, it's okay, I went through it, I did it, it worked great for me. I think like that really helps accelerate the relationship. And then on my side, I have to you want to be establishing, it might sound obvious, but you want to be establishing these relationships with other providers that you like, that you respect, that you trust. Like, would you send your patients to them? If not, don't look at this as like, I'm trying to just get referrals out of this. You really want it to be two ways. So I refer out my patients all the time, because I'm not a chiropractor. I'm not doing that type of care. I'm not doing the same even biomechanical analysis that some of the sports medicine chiropractors are. So it has to be a two-way street there, or it's really going to kind of sputter out and die pretty quickly.
Interesting. So on another note, right, COVID, you said the impact, well, actually, let's dive deep into this. I have a couple questions here. Where should I go? I like the email. So I want to understand the specific email chain or whatever, right? So you send a cold email chain. Do you have a specific subject line you use? Because it sounds like cold email is your first go-to method. Or do you say, okay, I'm going to cold email them, then if they don't respond, I'm going to do a call? What's that sequence?
I try to just get a sense of, this is really, really general, but how kind of tech, how into tech they are. Like, like, do they have a pretty well fleshed out website, and do they actually have a place where they're wanting to receive communications through that? Are they on all the different social media platforms? Or is it really, I'm not seeing that whatsoever, so I might assume they're not really into tech, not really checking their emails very often.
So then you have to go in person or something?
Then I'd probably go for a phone call. And then, yeah, I've a lot of times called clinics and then shown up and left my business cards. And again, it's just because I've introduced myself first and I truly am interested in meeting that practitioner, that I get that ball rolling, but the communication back is pretty successful.
Interesting. And then what's your favorite method overall? Is it cold email? Because then you got like a script or something you send?
I would say like that has been a something that I've used a lot in the past, and just over the last couple of years, pretty much so many people are going into social media that it's probably connecting with people primarily on Instagram, I would say, is a really common one, where you're seeing the posts. I'm following other practitioners. So particularly if I'm interested in getting to know another practitioner, seeing what they're posting, commenting on that, and getting the communication going. And I've had a number of practitioners in the area where I didn't know them before Instagram. I don't believe that I know anyone that we have in common, and just based on finding them and then communicating with messages through that, then have met them in person. And now we use each other as part of our referral network.
That's fantastic. So I'd imagine, normally I ask people about challenges, but it sounds like you were fairly well suited to just thrive in the COVID environment because you've had this methodology we covered, right? So like you've got, the outreach, you know how to use Instagram, et cetera. So it sounds like, any takeaways here, guys, from this interview today, it's like, if you are used to doing the hunting, there's either farming where you create content and you wait for people to come to you, or there's hunting and you go out. If you get used to reaching out, doing outbound, then it could really help you. And also you've really got to figure out what type of potential partner you're dealing with and what are their preferences in advance, right? To get ahead of everybody else who's just cold spamming, and cold spam obviously doesn't work, because we've tried it, and I'm sure a lot of people have tried it, and it's just horrendous. So that's awesome. Dr. Angela, if you could give like one vital action tip or a next step to, our audience, what would you say they should try to, take their practice to the next level?
Well, the next step after this, what we've all been talking about, is how do you keep that relationship going, and how do you further it from, they may send you one patient, but they kind of sort of know you, but they don't really, so they're not sure. They're not going to send you 20 patients at once. We're going to kind of see, like, how do you work with my patients? How do you work with me as a practitioner? So I'd say the biggest thing, and now with electronic charting, it's really simple. But even if your system doesn't have this, is to set up a coordination of care template. either in your charting system or even a Word document, and where you have this template set up that after you see that patient, and if you're the type of practitioner that sees, say, like several visits in a row and that's one course of care, then I'm not saying send that after every single visit, but after you see that patient for the first time, you gotta communicate back with that practitioner. They wanna know, what are you thinking? What are you wanting to do? How is it working with what is already going on their care with that patient? And I've had many practitioners who refer me patients say, that was the best letter ever. You explain same things so well. I send my chart note along with that letter. It's like a full 8.5 by 11 usually letter. And they want to know what I'm thinking, because that's the reason that they're referring.
I think that's a huge takeaway from this interview, right? It's like everybody can figure out the outbound, et cetera. But if you actually, because you're going to get a referral eventually, but if you take it to the next level and after you get that referral, you let the doctor know what happened, that their referral was taken care of. Then now, even all your existing referrals are getting in your network as a doctor out there. If you tell people, hey, thank you for, whatever, referring ABC, this is what happened with them and this is how I took care of them. Now you can actually get more referrals and grow your business that way. So awesome. Well, thank you so much. You made it through the interview. So tell us, plug it up. Tell us, what should we be checking out? What book of yours should we be reading, or website should we check out? We'd love to know.
Great. Okay. So pretty much everything that I do whatsoever at one point or another is connected to my website. So that's the warehouse for most everything. That's drcortal.com. So it's DRCORTAL. My new book is Younger Joints Today, and you can find that on Amazon. You can search Younger Joints Today or my name. And all of my online classes, programs, everything, you'll find that through my website. And for those based in Oregon who are wanting to see me as patients, all of my clinic info is in there as well. And,
awesome.
Facebook and Instagram.
Yep.
I'm on there a lot, and the handle's the same for both. It's Dr. Angela Cortal, spelled all the way out.
Thank you so much. And thank you guys. This was another episode of Vital Doc Talk.